I can't understand the people who don't want to get vaccinated, if they don't have a really good reason, because I don't think anybody wants to be the last person to die in the pandemic, right?
Okay,
Just
I think
about
we're
to
live
go
on
live now.
we're live on
Going
YouTube
live
now.
right now. Yep. Sorry about that, guys. I
That's
still
good.
don't
Thank
have the
you.
codes coming to my phone.
All right. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law and the governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southborough Municipal Technology Committee will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at the Town of Southborough's website at southboroughtown.com. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner by finding the meeting at southboroughtown.com/remote meetings. No in-person attendance of this meeting of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the meetings and proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on Southborough's website and YouTube an audio or video recording, transcript, or comprehensive record of the proceedings as soon as possible after the meeting. So I'll call the meeting to order at 7:10 p.m. Thanks everyone for joining. First, let's take a look at minutes. Larry, do we have some?
Yeah, I'm still one behind. I've just been under the gun on a bunch of things, but
Sure.
I send one out to you for the March meeting. So I have to do the April meeting still.
Sounds good. Let me pull that up. Let's see here. Minutes of March meeting. Perfect. All right. Let me share my screen. Would you mind making me host or co-host?
Yep, I'm gonna do that right now.
Thanks. Perfect. Oh,
I don't think that was.
I hit.
Okay, there it goes.
I clicked on the screen share button, but then it's the wrong button. All right. Let me
I
share
don't
my
think
screen.
you're sharing yet.
Yeah, I'm not sharing yet. There we go. All right. So, approval of minutes. March meeting was the historical commission. Requesting the biggest takeaway, well, two big takeaways are from my call is, and documented here, is that there's wires or fiber in place. They're looking for assistance with getting fiber, and I think tonight we might have an update on that. And then, of course, there's the building department challenges with syncing up historical commission and building department permits, etc. Processes. We voted to the procedural change and continue to work on our strategic technology plan. Discuss the citizen survey. I think that was pretty much it. Any discussion? Or motions to amend, correct, etc. Mr. Litt has a comment. Go ahead.
Sorry, you did on the documents list, you did reference implicitly the rules of procedure since you voted a second time to amend them?
I don't know, did I? Let me see. Uh,
I think that's item E.
You're right, okay. So somebody want to move to amend the minutes, and I'll update that.
I move to amend the minutes, add an item E that includes the rules and procedure that we voted on. Any seconds?
Second.
And let's go with a roll call vote to amend the minutes of March meeting with rules and procedure added as a document to use presented in the meeting. Will?
Aye.
Barry?
Aye.
Angela?
Aye.
Myself, yes, agreed. Any other amendments?
And one other thing, I didn't see mention of when you were talking about the fiber for the historical commission building. We did observe that may not be accessible because it's owned by the vendor, or at least we think it probably is.
That wasn't really clear at all.
Yeah, I don't think there's certainly no decision based on that. I think we raised the question: was it,
Well, since
what's
it
the
said
status?
AT&T on the box, and it was pretty clear who owned it.
I don't recall as though the MTC discussing.
I mean, I'm happy to add that, but it seems to me that the last line of the section, somebody needs to investigate the fiber and determine the right path, is sort of all encompassing. But if somebody wants to amend, it's a minor change. If somebody wants to move to make that amendment also, I'm happy to add that.
Yeah, personally, I don't think we need to necessarily amend the minutes because it was open question in my mind. Yeah, still after that meeting, there was no definitive,
I mean,
understanding of
the discussion was that our town fiber terminated at that building. At least that was the conjecture. And if that's the case, either that's our fiber or he's not looking at the right fiber. I mean, we just don't know. And clearly, what was his name? Michael? I can't
Yes.
remember.
Michael.
Michael, clearly didn't have or claim to have the technical expertise to make that determination in any case. So, I don't really think we had any real information there. But like I said, it's not a major point. So if we want to know, that's fine.
I'm not quibbling. It's just my mental recording of the meeting said that he identified the box as being owned by AT&T and suggesting that therefore we could connect to that fiber, which clearly
for him saying
is
that.
questionable.
He said that, but my also mental recording of the meeting says it needed to be investigated just to verify and confirm. So, and find out not just that, but like where the strand's going. Are they going to the right location, et cetera? So, for the purpose of the minutes, I don't think we need to add that level of detail. Okay. So any motions to accept the minutes with the voted on additional document?
I move to accept the minutes with the voted on additional documents.
Okay, I second that. We have a roll call vote to accept the minutes with the additional documents. Larry?
Aye.
Angela?
Aye.
Will?
Aye.
Myself as aye as well. Right.
And the motion, I didn't get it down. The motion to amend. Who made that motion and who seconded it?
Will Warren made that motion.
And I seconded it.
Okay, and that was true of the motion to accept the minutes also.
I did not make. Did I make that motion?
Yes.
Oh, well, I'll confess to it. Okay, that's fine. As long as it doesn't carry a civil penalty or something.
You'll have to answer to Tim on that one.
No.
All right. All right, we have first thing on the agenda tonight, discussion of Board of Health. Let me start sharing my screen, and we have uh, Mary Lou Woodford. Ms. Woodford, join us. Let me promote to a panelist. Second. Good evening. Thank you for joining us. So, as is custom with MTC, our goal is to rotate through different departments and to get to know the business processes and technology needs of the different departments and find ways as a committee how to help them. And starting a few months ago, we started doing this in a much more structured manner with a template that Angela had put together. So I took the opportunity this week, yesterday it was, to sit down with Mary Lou and Heather from the Board of Health and to fill in this template and bring it to discussion. So let me share my screen. So once again, I really enjoyed this, as I've done in the past, getting to know both the town departments and the individuals that are running this town, because I'm still painfully ignorant about the inner workings of the town and who does what and what services provided. And once again, I was pretty impressed about all of the things that this department does. And what I'm excited about is I feel like there's opportunities for improvement, both sort of shorter term, as well as potentially some longer term items. So let's, any comments or discussion before we jump in and walk through the key services that are provided by the Board of Health?
You'll provide this document to me for the minutes?
Yes.
Thank you.
Yes. Yeah. Okay. Board of Health, one of the key sort of categories of services so basically the way this is work, I'm going to walk through these, and then Mary Lou, you can correct me if I say anything wrong, which I'm sure there will be things. And then we can discuss the item and brainstorm ways we can potentially help and research sort of action items from this. So one category of services are inspection services. Inspection services are divided between Title V septic, food inspections, and housing code inspections. There's also animal inspections, but the department is not currently doing those due to staffing limitations. So starting with the Title V septic, this is of course at installation time, basically, or any terms of enlargement, expansion, significant changes. It's responsibility of the department and the inspectors to review the plan, make sure that the installer is properly licensed, and follow up at various different phases of the installer process. It's not just a before and after. So there's a few different phases there. And then, of course, issue a certificate of completion at the end. So this, another thing that triggers the Board of Health intervention or review is at the time of home sale, the Board of Health is notified of the status of the septic system inspection, because I guess it's sort of a legal requirement that at a home sale, septic systems needed to have an inspection done. And that is very commonly done for any lien holder. So anytime you go through a mortgage, those lien holders will want to make sure that the property that they're acquiring lien to have a septic system in proper functioning order. One of the sort of pain points or potential loopholes that would be nice to close is that cash sales. And I don't know what everybody else has heard about it, but I've heard more and more homes are being sold through cash sales. I have a few realtor friends who are telling me, how much above the asking price that homes are going for nowadays, all cash, and they're waiving, the bidders are waiving the right for traditional inspection, because there's it's such a competitive market.
If
It's crazy. So right now, all of this Title V septic inspection is done through paper. Basically, notification. They keep track of images. There's a file on every address in town maintained at the Board of Health office, and it includes, for more recent septic systems, an actual diagram of the septic system and specifications on it, etc. And basically, it's all about managing paper files. And so it would be nice for future technology to have actual software and maybe like mobile devices or iPads tablets to take pictures and enter inspection info, etc.
Matt, are they going to do any back file scanning and image some of this stuff, if only as a
That
backup?
that would be absolutely, that should be sort of a key requirement of scanning existing docs into a new system.
And also, I mean, if you do that, you could conceivably, not with any really super special software, but people could go and maybe look up, has this been scanned yet? And then the other possibility is if you can also do back file scanning based on request. So if a house is getting sold, that's the time you go and you make sure that its plans are imaged.
Yeah, we can think about, once we have the software, we can think about what would trigger it. Either it's a bulk upload. Ideally, it would be like a one-time payment. We pay a contractor, come in, scan everything, and so forth. But if it were a loose consistency or what we call eventual consistency processes would trigger at home sales. But I worry, my concern, one of my concerns is actually the redundancy of the existing docs. And we need to get these into electronic format that much more durable than one location. Sorry, Mary Lou, did you have a comment?
Well, I just wanted to let the group know that one of the things on our agenda, our plan, is moving to exactly what you're talking about, digitizing so that there's a searchable format. And we're in the process of hiring a consultant that could actually come in and look at how do we index all of this? How do we scan it? Because we have multiple files, like we have large plans, we have photographs, we have documents. How do we scan this in a way to digitize it and then give us a recommendation of how to move forward? And so that's one of the things that I think we'd love to have your input and your feedback, and how do we find a vendor to do this and help us in a way that's going to be the most efficient and effective way to do it.
One of the other things to consider here is geocoding, getting accurate geographic locations for each of the components of a system. Because sometimes when they build something to plan, they run into a rock or something and it isn't exactly where the plan originally said it was. So when they take pictures afterwards, if one can get as built, that's valuable to the department.
I've had discussions with the police chief, the fire chief, and he's interested in trying to get house plan, floor plans. And I'm kind of wondering, if indeed we get software that allows for some sophisticated indexing of things like that, maybe he could piggyback on that. I don't know.
Well, the assessors have general plans for houses in their database.
Right.
So this is another one of those cases where, if we're not careful, we're going to build silos.
Well, yes, and I would hope that maybe the assessors and
So we have assessors,
whoever else, right,
we have assessors, we have buildings, we have health, who all maintain records.
fire.
And then fire maintains a different set of records for, anything that has flammables,
Right.
whether it's oil or gas, propane generators.
Okay, good point. Okay, any other comments on septic before we move on? So in terms of Angela, what are your thoughts? Should we talk about management now, or should we walk through them all and then come back to management? Like, what are the action items here?
Why don't we finish the services and then come back to
Okay.
the action plans?
So Mary Lou, what happens when a septic system is pumped out? Is that another triggering event in terms of potentially triggering an inspection or at least an update of your data?
It's an update. So when people have their tanks pumped, the pumping organization reports to us that they've
Oh.
been pumped. So that's just another piece that gets added to that address file.
Cool. I'm just curious. I mean, I try to have my septic system pumped about every 2 years or something, just to make sure it's healthy. Am I the outlier there, or am I?
Well, that's pretty much right on target. You don't want to pump too often because you need that healthy bacteria in your system.
Right.
And it really depends on use and how many people live in your house. And so 2 years is kind of the average when
2
people
years,
will have
Bill.
theirs pumped.
Okay, good.
All right, let's go on. One thing I missed is that if the septic system is found efficient based on the inspection, then obviously there's another workflow that is triggered and follow up. Another type of inspection services is food service inspections. So this is inclusive of all schools, restaurants, commercial kitchens, home kitchens. Typically, these are paper files for each location. But the town is going into a cooperative with several neighboring towns, Northborough, Southborough, Westborough, Boylston, on a software as a service called Food Co Pro to handle these. And this is, it will be handled via tablets, it's a SaaS service, and all the records will be kept online. So that is fairly good news. What is the timeline for that, Mary Lou or Heather?
So that was, we just received the award a couple weeks ago. We're still ironing out the details, but I mean, we should be able to have that up online by July is my guess. The money's coming quick, and we're in the process of defining the the details of the actual grant. It's a shared service grant. So as part of that grant, each town that's in that shared services grant will get the software and the tablet will get paid for through the grant so that we can start using that software. I would presume the first of the fiscal year.
Does that grant include necessary monies to scan existing records? And is there anything on existing records that would need to be scanned? Or again, forgive my complete ignorance of how restaurant and food inspections work. I assume you don't maintain any sort of like layout of the kitchen or something, and that is every sort of renewal effectively just like a fresh license, and there's no previous data you're retaining, or
Well, the license is different. The license is an annual license, and the inspections are supposed to be done twice a year. We haven't been doing twice a year because of staffing issues. And so part of the shared services grant, we will be in compliance. They will be doing them twice a year. Obviously, if there's a complaint, we do follow up on any complaints that we have. I don't know about backdating. That's a good question. I'll bring that up in the next meeting that we have. I was under the assumption that it's just from this point forward, but if it's going to be, if all this information is going to be in a central, I presume a cloud storage area, like, is there a way that we can sort of
Yeah.
back the things in? I
Yeah.
don't know the answer to that.
Yeah, bulk load. Yeah, that's going to, again, probably take some cost. And so it'd be great to find out if the grant covers that as well.
It seems like it would be good to have some history because, when you have a history of violations, you treat new ones differently than the first violation.
Right.
The other thought that has come to mind, because I've been thinking about this one for a while, is I think someone needs to find out what the capabilities are for extracting data from this software and what APIs it may offer. Because, again, this is another one of those silo things. And at some point, it would be good for the Board of Health to have, one place to go that says, okay, given this property or this owner, what's going on, instead of, having 9,000 different sign-ins and information, entered repetitively and becoming inconsistent.
Referring to, Mr. Lee, referring to basically some sort of analytics to.
Well, they're buying new software to support the inspections. So that's going to generate a record that says, this establishment at this address, we inspected, we found this, and so on. Well, the assessors have a different thing about this address. And we've got a different file even in the Board of Health for the septic system for this address. And we've got something else going on with the trash haulers, at this address. So every time we introduce a new system into the town, my standard question is, can we get the data out of this system and use it somewhere else? How do we make sure it isn't going to diverge? And if we're going to automate this stuff, does this software offer APIs that, if there isn't already a way to integrate it, that we could have a project someday to do that?
Do you have a comment, Larry?
No, I was going to react to
Okay.
what Tim said, but I changed my mind.
Okay. So yeah, so I think to me it's crawl, walk, run. We today are paper-based. We need to get on some system. I would much rather have this separate, completely independent system that doesn't talk to anything else, electronic and paper-based. And it sounds like this is already in motion, meaning we're not going to have any influence over selection of Food Co Pro, at least this year. Possibly in the next year, if there's other options, we can we can discuss. But fully agreed. If there's opportunities for integration, though I personally have fairly low hopes that things like off-the-shelf SaaS assessors applications and off-the-shelf police and fire applications and Board of Health septic SaaS services and food inspection services, it's high on their priority list to correlate and integrate with other systems. But
it is in alignment with our tech strategy. We talk about being a data-driven town and actually leveraging the data. I think pulling the data into a central warehouse is one of the first steps that would allow us to really begin to get more insight into the data. And eventually, we're not there yet, but 5 years, could the town have a data analyst who actually, looks at this data and is able to report on it in different ways and give us different insights from the data. So, while I don't know if this exact opportunity is the one that's going to help us get on that path, but I do like that idea of trying to look at how we can begin to centralize the data more. I think that's a good thing for us to kind of consciously be asking with all these different groups.
Yeah, although, I guess I view it a little bit differently. Each of the functions we're talking about is a fairly specialized function. The problem of maintaining information about septic systems really, thankfully, is a little bit different than keeping track of restaurants. I guess my fear is that trying to find a way to do those in some centralized form will result in sort of less than best of class in any of them. It seems to me that this might be more. I mean, for example, I'm not looking for anybody to integrate my stock account with my UMass medical records, for example. They're different problems. But the point is that it seems to me that there is a top-down problem here. I don't know what the right solution is, but in essence, the one thing that's constant is there are a set of properties. There are, I don't know how many properties there are in Southborough, 3,000, 4,000 properties in Southborough, probably something on that order. And that each of those properties has a set of characteristics. Some are food services locations, most have septic systems, some are rental properties and therefore might have housing issues. And that even though each of those might be handled by separate systems, having some kind of centralized property management system or just database that allows you to point to those. So I can say, okay, 110 Main Street, open the record for 110 Main Street. Here, click on the thing that takes me to the septic information for that, even if that's a separate system, rather than having this dispersed. There are 5 systems with 5 different logins maintained by 5 different departments, and there's nothing pulling them together. So it seems to me that the coalescing function is the important one, not trying to come up with the individual systems that
like one system to rule them all. I don't think that's what Angela is referring to. Angela was, I think you're referring to a data warehouse that can pull at least.
If they all have
Those are things
APIs, you can always get
analyze
at the data.
Right. Okay,
I
I'm
do have
sorry.
to-
I misinterpreted. I
I also
apologize.
do have to say, Larry, I do have the hypothesis on your specific example. I do believe that as your stocks took a dive, your blood pressure probably took a spike. We probably can, correlate that. So yes, integrating your stock system with your healthcare would.
Yes, but I wouldn't want my doctor to know that.
So Larry, I agree with you. I agree with you in essence. The 2 things that I think are important. Number one is making sure that there's a way to get information out. We may not know exactly how to connect it, and I'm certainly not arguing for one ring to rule them all. But if we can't get anything out, that's a problem.
Yeah.
And the time when you're implementing a system is to make sure that the contract allows you to do that. And then the second thing that is worth looking at for all of these is single sign-on.
Agreed.
Federated logins or however you want to go at it.
Definitely.
Yeah, big ones for me are the single sign-on, obviously APIs, and log emission as well. We need to start looking at everything, emitting logs to a common log source for, log store to, for future forensics in case of security events.
Yeah. So do we have someone who Mary Lou can put in touch with the vendor of this?
We're still going through other items. We're not
Okay.
going to do the action items, but yeah, we'll action these. But yeah, let's go through. Okay, next thing is housing code. This is typically complaint-based, and it's typically between the renters and landlords, so it's more on rental issues, and typically complaint-based. So, yeah, so basically there's trash or there's no water or etc. So these, it seems like these are all handled via, manual. So it uses new permitting system. Could you, for the building department items, they use the new permitting system. Correct me if I'm wrong, Mary Lou, but these are currently handled via paper. Is that correct?
They are, but the one thing we forgot to talk about when we talked yesterday was, as part of this shared services grant, there's a housing code software that we're going to get also. So as well as Food Proco, there's a housing code software that we will get as part of the shared services grant. It will act similar to the Food Proco. I don't know the name of it right now. But I will find out, and I will ask specifically if either or both of them have API capability.
Oh, wonderful. I didn't realize that. So, and you don't know if it's the same vendor or a different vendor that's.
It's a different
vendor.
vendor. Yeah.
Yeah, and
Insert previous comments by reference.
and the current process is paper. I actually went through it myself because I pulled a permit for an addition to the house a few years ago, and one of the signatures I needed was from the Board of Health, which was like 6 steps away from the building department, but I had to take the form there, and they pulled the paper file from my house and pulled out all the septic information and drew in, or had me draw in where we were doing the addition. And so all of this was done basically all on paper, but
as of last year, though, there is a new permitting system. I think it was last year, or maybe it was the previous
right,
year.
this was about 4 years ago. So
Okay, yeah. Since then, within last year, there's a new permitting system, and I can attest from doing finishing off our basement. I've gone through the process. There's opportunities for the improvement of the user experience, I can say, but it was certainly better than paper. So.
But it's still paper blueprints, and they're still spread out on the table down there, and people, still take a pen and sign them, right, Mary Lou?
Yep. Yeah. It's pretty old school. Where the whole department's old school.
Yeah, I don't think we've. Yeah, all the records are still in. There's a lot of paper. I know at least for when I submitted my plans for my basement, I just submitted them electronically. I don't know if those were then printed off and added to my house's file.
I'm sure they were.
Okay, so that would be a future discussion with the building department.
Yeah.
It's all related, interconnected. Like we need a housing code software, yeah, to cover this. So, all right. So annual inspection, as mentioned.
Yeah, I
currently,
think the housing software is like Housing Code Pro, but it's definitely a separate software than the food.
and it's called Housing Code Pro.
I think it's called Housing Code Pro.
Okay. As part of grant. And correct me if I'm wrong, for both the food, is it Food Co Pro? Or is it Food Code Pro?
Oh.
Code. Food Code.
Okay, so it sounds like it might be the same vendor. Food Co Pro.
They have similar names, so yes.
It might be the same vendor. I don't know either of this software, but it could be the same vendor.
Okay. Sounds good. For both of these, do we know they're being provided as a grant, but this is software as a service. There are probably annual expenses associated with it.
Right, there's annual licensing fees for each town.
And so for this first, how long does the grant give us for? Is it just the first year?
3 years.
Oh, 3 years.
Yeah.
Okay, nice.
is the housing code software also covered under the same grant, or is it a different grant?
Same grant.
Oh.
Same grant. Yeah.
Awesome.
The thing that we didn't get, and actually want to do some homework, is that the Title V does that same vendor have Title V software? It's not included in the grant because no one else needs Title V like Southborough, so they didn't care about that.
So you confirm, does the vendor have? Do you know for sure that the vendor has Title V software?
No, that's what I'm saying. I think I need to do some homework to see if they do, and if the software, if it's all the same vendor, it might be beneficial, and it's a good way to do it. So, but I will look into that.
And I can probably infer by their convention that it would be called Septic Code Pro.
Yeah, probably.
Angela, did you have a comment?
No.
No. All right. Let's jump on.
So animals, in the normal years, you do a rabies clinic at least. And there's some interaction with the town clerk's office who issues licenses for dogs.
Yeah, but none of that's happening. I mean, there's technically should be an animal inspector that inspects barns, inspects anyone who has animals, whether they're chickens or goats or cows. That's just not happening right now. So I just put it on there as something that we need to, as we start to come up to speed on, meeting all of our requirements. That's one thing that's there, but that's not being done right now.
Yeah, but until the pandemic, you were doing a rabies clinic, right?
Yep.
Just rabies, but we weren't doing animal inspections.
I just didn't see that
Yeah,
elsewhere flying by.
Lyme disease, immunizations. Yeah, we'll get down there. I think we added human immunizations. I don't think I've added animal. Okay, disease prevention. So that's all. That covers the inspection services. Then we're getting into disease prevention and control, which are the two side there are investigations and contract tracing. Most of this is run
Can I
by.
ask how big the department is? How many people are in the Board of Health?
So we've had 3 part-time people for many years and got way behind. And it's been a struggle. We finally have 3 now full-time people. If all goes well at town meeting on Saturday, we will have 3 full-time people in the department.
Thank you.
And most of the is it correct to say that most of the work of these full-time individuals is simply coordination, and that the actual inspections are contractors, or are these people the actual?
So it's a little bit of both. So currently our inspectional services is through a contractor. Paul Pazinski, who is our health agent, who was the health director up until this past January. Paul is certified to do inspections. So when someone calls, if you think about when, like you said, you were redoing your basement or you had an addition to go on, you have a lot of questions. So you call, like, what is the process? What do we need to do? And so Paul was able to answer those questions without engaging and paying a contractor to come in and do those things. And so we're kind of a little bit stuck between a rock and a hard place now as we move forward. Dr. Heather is public health background, but she's not a sanitary inspector or an environmental inspector. So we're hoping that our fees, because the fees that come in for all of these inspectional services have pretty much resulted in a net balance because the inspectional services are paid from those fees. This year, we'll bring in about 59,000 in inspectional fees, and we'll pay out about 52,000 to the inspector. So we actually might have made a little. Last year, we probably lost a little bit. It's really different year to year. Hopefully, we can get a revolving fund for inspectional services, and that will help with that. But yes, the inspections are done. We have someone who works specifically for the health department, but he's an independent contractor. His name is Dennis Costello. And then the other work, the immunizations, the disease prevention and control, the contact tracing, that's all done by Board of Health staff in-house.
And you're also, in the short term, you have additional staff that you're hoping to get through federal funding, through CARES and that sort of thing. So the department's a little bit bigger than it appears, Angela, but not permanently.
Yeah.
Okay. Both the investigations and contact tracing, at least there's a central state database called Maven that a lot of the the actual database is used for keeping track of the outbreaks, etc. By the way, before we move on, I just want to acknowledge Mr. Donovan, who's recently appointed by the Library Board of Trustees as an ex officio member of the MTC. Is there anything in procedure we need to do, Mr. Litt, to acknowledge? Or
no, just promote him to a panelist, so he's forced to face the rest of us.
He's a panelist.
The other thing, by the way, is it's contact, no R. It's not contract. It's who you're in touch with.
Agreed. Yeah. I forgive my grammatical and spelling mistakes in this document, as it hasn't been reviewed yet. So thanks.
It's all right. Blame autocorrect. I do.
Well, contract could have been contract. You didn't know the context. Okay, so one of the challenges with Maven is that it's not meant to be a, so Maven, there's a concept, I mean, think of it being a standard database. There's a case ID or Maven ID for each case. And so when Southborough interfaces with other towns to discuss particular cases, and of course because it has lots of PHI inside of it, you know, our town will contact another board of health and email them the case ID, so you don't have to send through email any PHI. But it's not apart from, I mean, it sounds like it's a fairly legacy database where it has a fixed number of fields and then a generic note section. It doesn't have in there any sort of messaging service or, active discussion. So, it's not good for active back and forth discussions that might have any sort of PHI in them. And there's only so much you can do with a notes field. So, I mean, it's more of a wish list, but because this is driven by the state, we're sort of chained to whatever the state uses across all entities. I question how much we can do other than to maybe reach out to the state and find out what their feature backlog is for future versions of Maven.
I
Well, the
think
problem is
that- so I was just going to say, I think the solution for us, like we discussed yesterday, was as long as we have the ability to send encrypted emails, Maven, like you said, Maven's, I worked at DPH. I don't see any miracle that's going to happen anytime soon. If COVID didn't change it, I mean, there were multiple changes and updates that happened to Maven over the course of the last year. And they all know, because there's so many people that have been in it. Every city and town has been into Maven. And so they've got a lot of feedback on ways to improve it. I think it will over time, but at least for us in the immediate future is giving us the ability to just send encrypted emails between other parties. So for the other people on the call, basically what happens is whenever a lab is done for any communicable disease, the lab is required to report to DPH. And they either report to DPH, and then that lab gets sent to the Board of Health of where that resident lives. So, if you live in Framingham and you have just been identified with a communicable disease, the Framingham Health Department is going to get notified that this particular individual, and then that information about their test is in Maven. So then as that Board of Health person, you got to go into Maven, find out what the result is, and then do the follow-up accordingly and report it within Maven. So it's all within Maven that everything gets reported. But then say which happened a few weeks ago, we got report of an salmonella outbreak, and it was a food handler that lived in Southborough, but they worked in a restaurant in another town. So we have to communicate with that other town. And Maven isn't, like you said, isn't the easiest way to communicate. So it's easier to just pick up the phone and call them or to email them. And so we need to be able to send encrypted emails.
Right. And today, a daycare called me with a 4-year-old with COVID. And so overseeing the schools in Southborough, the daycare will provide a list of in-school contacts who will need to be quarantined. But that, again, needs to be discussed with the towns of jurisdiction.
Oh, that's sad. But yeah. So there needs to be some way. I mean, if this is not going to be added to Maven quickly, then we need a way of
The email. I think
encrypted
the
email
would.
Email is urgent. That's one of our, I would say, urgent needs that we expressed with Jason at, having a working fax line, and that's a HIPAA compliant fax line, and having encrypted email are our two really urgent needs that we need to figure out ASAP.
Yeah, PGP is pretty easy to set up, and you don't have the infrastructure of X509 email. What I was going to say is that when a system doesn't work, people will use the side channels. So whether that's email or Twitter or whatever you can get your hands on, you want to talk to someone. So I think encrypted email is certainly important. The other thing that needs to be looked at from a compliance point of view is the whole office area question. I mean, if you're having a discussion in an open office area that people have to walk through in order to get to other departments in town, which happens to sort of be the way the health has been for some years, there are those sorts of physical issues to worry about too. I mean, it's
Yeah. So we'll come back to email, challenge with email, whatever system you use, it needs to be supported on both sides. So it's pretty easy to set up, but you need the recipients to be able to support GPG and whatever encryption scheme
Yeah,
and so forth.
I've actually started the process of looking into a piece. It's a component in Sophos that we currently have that could possibly fill that void that we have with encrypted emails. I started to do some testing with it. I'm trying to see if it's something we could just add as a module, and it could be a simple fix for that, for that hole there with the Board of Health.
Yeah, the issue is always key distribution. It's
Yeah.
not whether the technology works, it's how you get, everyone who needs to communicate using the same system and having each other's encryption keys.
Yeah, luckily this Sophos system, I'm guessing, is solving this. I'm guessing the Sophos system solves it like many of the add-on large attachment systems do, which are instead of sending the actual body or anything in an encrypted format that has actually decrypted on the client, all it does is it uploads it to some cloud service, which is HIPAA compliant, and sends you, the person, a link to, to download it through the cloud. So it doesn't actually transmit it through email. It just sends it through a cloud service.
Yeah, you would typically log into some type of platform and create a password and be able to see that email on the other end.
Yeah.
Yeah, and many hospitals use that type of system. I communicate with them regularly, and that would work too.
Okay, let's move on. Immunizations. This is basically clinics, so flu, COVID, etc. And the state has an MMIS system. Once again, this is a built for purpose system to track who gets immunized, but it doesn't handle all of the paperwork necessary for handling vaccines and so forth. And it sounds like there's lots of paperwork and lots of it is manual as of today.
All of it is manual.
Okay, all of it is manual. And there's also the issue of collecting billing insurance where possible. Apparently we use Commonwealth Medicine, UMass, to handle insurance billing, but then there's always there's apparently they just bill insurance companies and we get a single lump sum check for a given clinic, and then there's reconciliation that has to be done afterwards. So it sounds like it's a lot of manual work that you should be able to keep track of through software.
Mary Lou, is this something that you would see like as a necessity that the town needs to provide, given that people can go to CVS, they can go to Walgreens, there's other avenues to get immunizations? Are we targeting a specific population or something with the town drives?
Yeah, it's funny you mentioned that, because that's in the past year as I've been sort of communicating with other boards because of our budget. And that's often the question that comes up. Well, why are we even doing this? You can go to CVS or you can go to this. And we have, we have to think about our vulnerable populations and, just thinking about many cities and towns, the Board of Health will go into daycares and provide immunizations in the daycare. And it's a service that you provide. We get paid to do that service because we get reimbursed for administration fee. So it actually makes money. But in that situation of going into daycares and providing that service, you're getting a set of eyes and ears in that daycare to see how safe they are, how well are their procedures being done. So it's a double, it's it's a service, but yet it also helps us to monitor what's going on. We have vulnerable seniors. We have homebounds that we did homebound vaccinations for COVID. We do homebounds for flu. We do clinics for Colonial Gardens. I feel pretty strongly that this is something that we really should continue to do. The people that are able and physically, can go to their doctor's office and get it. All doctor's offices don't carry immunizations. So you might have to go to CVS, you might have to go to Walgreens, and everybody doesn't want to do that. And so it's just a service that I think really helps in a lot of ways.
Could I ask a quick question? My understanding is that some of the surrounding towns do not have boards of health. Is that true?
No, every 351 cities and towns in Massachusetts. So just to give you a quick 101, and Massachusetts is unique to the entire country. Every other state in this country has county-based health systems. In Massachusetts, we have 351 cities and towns that all are responsible for their own local public health. And this has been a problem. And the state has known this and tried to sort of figure this out. Local towns are responsible for the budgets that manage them. So in that case, in a town, of 1,000 people, they might join with 2 other towns to provide those services, but that town is the responsible party for getting done what needs to get done. And the state is now looking at this part of the shared services grant as one way. I really think that there will be sustainable funding that's going to come to local municipalities to provide local health, because COVID shined a light that we were just completely inadequate. We didn't have a communication system across the state to be able to communicate readily. Heather and I have been on, 2 or 3 calls a week, just trying to keep up to date with what's going on. And the state recognizes that. But in the meantime, we're responsible to administer the laws and regulations that are required in each city and town. And each town has, or city has, different, demographics. I did work in Framingham over COVID just to help them with COVID contact tracing. And obviously the demographics in Framingham are completely different. When we in Framingham hit their 10,000th case of positive case, Southborough had 221. So, it just shows you, 2 towns right next to each other. The demographics are going to drive a lot of the local public health that's done. In Framingham, they do extensive work within the schools. We haven't done as much in the schools as we could and should. Each town is responsible for funding and staffing and managing their local health department.
Actually, maybe I was thinking more that some of those surrounding towns don't have full-time nurses.
Oh, no, many. There are some towns in the state that have no nursing. And so when COVID hit and they had to do contact tracing for all the people that lived in their town, the state put together, through Partners in Health, they put together a statewide contact tracing team.
Right.
And they were in charge of, because the towns just didn't have the capacity. They didn't have staff. They didn't have anything to do. And I worked with that group and Partners in Health, and, they hired people. Some don't even live in Massachusetts. And so when you're talking about, what's local, it's like when you call a service center from Texas, when you're calling a company in New Hampshire, right? And they don't really know what you're talking about. So that the COVID team that the state put together was okay for some of those small towns, but we didn't really engage them in Southborough. We felt it was more important to connect with residents to have a better understanding of what's local. So we hired per diem nurses to do that instead of sending them to that state COVID tracing team.
And my other town has a year-round population of 400. It has an independent board of health. It does talk to some of the neighboring towns, and they have a coordinating committee of some sort. The other thing I'll say to reinforce what Mary Lou was saying is that depending on where you look in the population, people are more or less comfortable going into a CVS. I mean, people sort of my age and above are not at all comfortable going into a CVS and feel much more comfortable with, someone they know, who lives in town, or at least they see every year, where, college age kids, it doesn't really matter where CVS is sort of the way they've been used to things. But, you get to the people who are in their 70s, 80s, and 90s, and I think it skews very heavily away from wanting to go into a mass market store that's supposed to be a supermarket and has someone who they don't know and don't know how well trained, and just sort of don't have that relationship and trust. And relationships and trust are really important in healthcare.
Okay, let's, yeah, great. Thank you for the discussion on this. Let's move on. Looking at the time, I know there's several other things we want to get to tonight. Let's try to finish this out next, say, 10 minutes or so. Emergency prep. This is working with fire, police, Department of Public Works, to ensure emergency plans are kept up to date, and participate in tabletop exercises, and have paper lists of individuals and plans printed out. So if internet goes down, you know who to contact, etc. Right now, everything is done on paper, but it would be nice to move towards something at least online collaboration, and then print off paper once the plans are finalized.
And Matt, Chief Achilles is a great person to, I don't know if your discussion with fire, he's very much into emergency preparedness. And I think we've just started, COVID kind of brought us closer together, the Board of Health and Fire. And so working together with him and figuring out, he might be a good person to know what software is out there, what we can use, what not, because he's been involved in this more.
Yeah. I'll make a note of that. And then finally, communication with the public is an opportunity for improvement. So first of all, we need to make sure that the Board of Health has full governance over their section of the website, or maybe been trained on it. I guess recently, to remove a banner, they had to go through somebody else on the public website. So that's something that Jason possibly can help with, getting you access to that.
Yeah, that was me.
Okay.
Jason was able to remove the banner that we've been trying to get removed for almost 2 months.
Sounds timely.
Yeah, very timely. And to that point, just quickly, is I'm trying to myself just try to understand Civic Plus a little bit more, like I was telling Mary Lou. And if there's a way that I can kind of delegate the small amount of power that she might need to update a banner or something, once I know a little bit more about getting that done, then I can maybe have somebody in her department do that as well.
Sounds great.
Yeah, we need to talk about accessibility of the town website at some point, Jason. That's a burning issue.
Okay.
Okay, this is sort of the general theme, and I think that this is not just a Board of Health issue, but I'm guessing we're going to find through the survey, Friends survey, is that this is, the citizens, the residents probably would like to have clear, better, standardized communications channels, and each of the departments would as well. So we need to figure out what the best way of doing this is. I mean, Board of Health would like to participate in social media and so forth, but I don't think I question whether that's a good plan, like every department having their own social media experts and pushing things out through social media, and what's the right platform and so forth. It seems a little bit disjointed if every department has their own sort of communication method. As a citizen, I would love to feel like I'm interfacing with the town, not 20 different entities with different communications methods and so forth.
Yeah, we have far too many websites, far too many social media things. And on top of that, all the ones we have don't have a consistent identity. So, in the corporate world, we talk about having a brand identity for, our, web presence. And we've got nothing like that here in Southborough. So,
Yeah.
I mean, even if under the hood things have to be a little bit fragmented, we can at least make it look like, oh gosh, I've got to something that looks like Southborough.
Yeah, that's one of the requirements is a Southborough style guide.
I don't disagree with anything anyone said, but I mean, you can see the effectiveness of the departments who have left the town website. I think one of the departments, a few have Facebook sites, a couple have Twitter accounts, and the way that they're getting the information out is much more effective because I think we just have RSS subscribe feeds on the town website, which nobody uses anymore. So, I get my information through the alternate websites as I think a lot of people in Southborough do.
Well, we also have the alert system. And one of these days, one of these years, I'll give a presentation on the software I have that turns the alert system into something that's actually useful.
And I think you're the only resident in town who actually does that. So the question is,
no, I'm not actually.
Well,
School has one call.
Tim, I'm glad you brought that up, and maybe this is the MTC is the place where we should have that conversation. I'm also have a residence in another state, or I have a place in another state, and they use their alert system regularly, just letting you know things that are happening, weather that's coming. It's just so helpful. And we don't use it. Even through COVID, I asked if we could use it. And there's a real reluctance to use it, to push out to residents. There's a vaccine clinic that's going to be available starting this Wednesday. And here's the sign up. Like there's some reluctance to do it. And I think our alert system, having an alert system would be an invaluable tool for the Board of Health.
Yeah, that's the telephone alert system, the reverse 911 thing.
Yeah.
And the constraint that people have worried about there, which is a penny's, wise pound foolish thing, is that it doesn't cost anything to send out an emergency alert, but to send out an informational alert, it costs the town some amount of money. And we just don't do it. The one I was talking about is the subscriptions you can make on the website that will tell you about, when minutes are published, when agendas are published, announcements of hearings and all that kind of stuff. But you're right, Mary Lou. I mean, the other one is underused, and it's underused for the silly reason that, we're not willing to pay the pennies or whatever it costs to send out non-urgent things because it's in no one's budget, I guess.
I think this is clearly an area spans not just Board of Health, but other departments, in an area that deserves a lot of a good investigation and planning, come up with a good plan. And and I fully agree with what you mentioned, Angela. There's a reason why, like, the rec department went to get a piece of rec department software, because there's no way the town website could handle it. Civic Plus has tried to do more and more modules, but I don't feel like they're necessarily best in class. And so that sort of, there's pros and cons. There are the ways of linking other websites under at least a common domain name and have them be maybe same look and feel, even though it's different software.
I did think that the schools had one call. Are other groups not able to access the school's one call account? Or
It's
maybe
it's a separate system and a separate distribution list, is my understanding. And I will say, my other town, when stormy weather moves in and, the ferries may be delayed or whatever, I get an email, I get a text, and I sent this actually to Chief Achilles a few months ago and said, hey, maybe we should be doing this too. It's the same software. I did not get a response.
Yeah.
But, as soon as the restrictions end, then I can stick my head in his office and be as difficult with him as I am with you folks.
Okay, let's go ahead and move on. I propose let's discuss the management or action items for each of these, and basically next steps, because we have several things we need to get to in the next 42 minutes. So looks like there is budget to hire a consultant or vendor for the Title V, and Heather and Mary Lou, it would be nice. Is it correct that it'd be nice to have some assistance from the MTC member to either recommend a vendor or evaluate different software to handle Title V?
Yeah, that would be great. I'll do some homework and find out what's out there, and if it's the same vendor that Food Code Pro, or in the same, I'll do that background and get back to you guys.
Okay. Is there an MTC member who would like to take this one on?
If no one else can, I will.
I was just going to say, I was going to look into an option that my last organization worked with as well for getting information out to the residents. I can talk to them again and just, I have connections over there that I can talk to them and just see what it was. Because that's how we used to send out for like snowstorms and also for a lot of the COVID stuff that was going on, information about what was happening within the organization and with the residents. So I can look into that as well.
Okay, for communications, I'll put you down, Jason. Love to have you investigate that. For the Title V septic, we'll put you down.
Thank you.
Thank you. And how about the other Food Code Pro and Housing Code Pro software? I think that's probably going to be more of an, we know it's what software that we're going to have, so it would be good to, at a minimum, integrate authentication with AD or SAML, single sign-on. This is going to be coming down. This is more of rather than sort of investigate what's out there and find the best solution. This is more of like an implementation. So, Jason, what are your thoughts on? Would you like to handle that? Given that it's like we know we're going to be using it. The question is how to handle integration, authentication, and so forth.
But you're talking about for the integration part of it?
Yeah, basically the implementation of Food Code Pro to see if there's a way we can integrate authentication of it against our AD or a single sign-on.
Yeah, I can look into that as well because I'm looking into the two-factor authentication stuff right now. If there's a way that we can incorporate that into it.
Great.
Yeah, I'll definitely look into it as well.
Yeah, in general, it'd be good to more and more our services if we can integrate with all the services through a single sign-on service. That single sign-on service through either OIDC or SAML protocol, one of the two.
Yep.
And then that single sign-on service also could handle the multi-factor authentication. So the application itself doesn't have to have any knowledge whether it's 1 factor, 2 factors, or 10 factors, or how the multi-factor works. Each service just says, "Hey, I just have an OIDC or SAML relationship with the IAM system, and the IAM system handles all the factors, etc." So yeah, it would be
Matt,
great. Yep.
I'm just curious. How would we, if we go to extensive single sign-on, who manages the rights of each user? Will that be parceled out among the different shops that currently manage their own passwords?
So typically, it depends, and it's granular. But what most case happens is that the IDP or IAM system handles the authentication.
Right.
The authorization, however, is done on a per application basis.
Okay.
So what rights you have in a particular application, because every application has different roles and role-based access control, et cetera, you still have to manage that within the respective application. But at least authentication, like, I am who I am, that's done centrally. But either way, I'm anticipating that Jason should be the one administering rights, not only in the authentication system, the central authentication system, but also authorization. Most likely, he should be handling within their respective systems. And maybe in some cases, Jason should be delving out authorization privileges to different groups, delegate so they can have their own privileges, of managing known roles. But I don't think we have too much of revolving door situations within town that, maybe with the exception of maybe some boards and committees, I don't know. But yeah.
Yeah, we still do need, to find the right places to make sure that accounts are terminated when people leave, and that it's not too much of a pain to get them when they show up.
Yep.
Both of which have been challenges.
Yeah. So
that has been a challenge.
That's one of the benefits of again, unified IDP.
Yep.
VSM OIC is that maybe you don't delete the accounts in all the systems, but at least you disable the authentication. And once you disable authentication, they can't get access to it. So, okay, great. We'll probably hold off on animal unless there's an Animal Code Pro software. Maven, I think if we can, sounds like Jason, you're working on looking into Sophos for email encryption.
Yes.
And yeah, wonderful. If that's something like a nice, easy plugin that's transparent to users, that would be perfect.
It should be pretty straightforward.
Records keeping for immunizations. And this is all the, filling out for handling and temperature, etc. Anybody else want to volunteer? Somebody want to volunteer to investigate options for that? See if there's services out there that handle that. What was that, Angela?
I said I can look at that. I can do some research on that.
Angela, if you want, at some point, if you want to walk through, we can, Heather and Barbara and I, the business admin who does all this. So like even just, when someone wants to sign up for an immunization, they have a paper form they got to fill out, and then they come back next year, they got to fill it all out again. So if we can figure out some systems of being able to follow and track that, that would be great.
Sure. Yeah, I'll contact you. I'd like to know a little bit more, and I'll feed that into the research.
Yeah, places like Boston must have something better than paper. So asking around other health departments might help.
On emergency prep, I'll volunteer to do that. I hold a ham radio license, and I think it's like, if you hold a ham radio license, people expect you to be involved in emergency prep. So I enjoy it. So. And then we have, Jason's already looking into the the alerting system. Okay. Anything else we need to discuss with representatives from the Board of Health?
Do we have an action item? So there's two priorities that were mentioned, the encrypted email and then the working fax line. I don't know if there's an issue on the fax side of the house.
Yeah, good point. This is something that we discussed in the past. I'd love, Jason, if we could start investigating like eFax or something equivalent.
Well, I looked into eFax, and so, and if anybody can correct me if I'm wrong on this one, I looked into it the other day, and it looked like if you had under 9 users, it was a $16 a month fee to have it, but with that feature, it didn't follow any of the guidelines for like HIPAA. So, but if you paid for the full corporate version, which was 10 plus users, then it would follow all those guidelines on top of it. And it gave you like a list of all the items that it would follow, including HIPAA. And the problem is it would only be like the Board of Health and maybe one other place in the townhouse that would possibly use it. So then we're back to that, we're still not following those guidelines. I also recently just ordered a multifunction printer, with fax line, just because I looked into the whole e-fax stuff and it didn't look like it was going to be an option. Again, you guys can correct me if you need to, but I ordered a multifunction printer, and I have John looking into, not looking into, he's pretty much got the process going of getting a fax line into that office. So once the printer and stuff comes in, then I'll just be setting that up, and we can at least go with that for the time being.
Just out of curiosity, is this an HP printer that you got?
That was a Xerox printer that I ended up going with.
Yeah, I mean, the reason I ask is I bought an HP printer some years ago, and I use HP Smart to print to it and scan on it and things like that. And recently, it requires me to log in to HP in order to use that that printer, and I just can't even believe what they're doing. I mean,
they want you to use their feature set. That's what they're trying to get you to do.
Well, I think what they're really trying to get you to do is to find out if you need toner and then sell it to you, right?
Yeah, exactly. That too.
Okay. So I think there's definitely other options for fax apart from eFax. eFax is one of the longest players in this, oldest players, and they go off their name. Yeah. There's newer solutions, like I did a Google search, and the second thing down is like a eFax service that covers healthcare, has healthcare specific plans that offers, $11 a month, and I mean, pretty cheap. So not saying that this necessarily meets our needs, but something I think we should look into.
Yeah, there's a site I'm looking at right now on SourceForge that's best HIPAA compliant fax services, and they list about 10 of them, 12 of them or something like that. There's a bunch. So certainly worth looking at alternatives.
And they're going to be cheaper than even a phone line per month.
Yeah. The other problem is that Verizon, they're saying already that in the next year or two, they're not even going to be supporting that type of line, the copper lines anymore. So we're back to, like, if it fails, then we really can't do anything about it. And there's been a lot of like different failures going on route on Carterville Road with Verizon recently. So if over the next year or so something does go wrong, it may just go down entirely. So we have to take this route anyway with some type of electronic fax.
The Fios fiber ONTs all have copper ports on them for that effectively provide equivalent of analog phone service for hooking up faxes and things like that. So I don't think it's disappearing. I believe they're not running any more copper to the building or buildings. But to Matt's point, the online fax services might, and I haven't looked at pricing of anything lately, but they might end up being cheaper than actually having Verizon phone service for fax.
Yeah, but voice over IP, I mean, I use voice over IP for my fax, and $10 a month in 2 years, you've paid for a printer, copier, scanner, fax machine.
Though, the other issue with fax machines, though, another benefit of electronic fax is that it comes into effectively email.
I know.
You don't necessarily have to actually print something off. And the issue with printing something off, especially personal health information that's coming across the fax, means your fax machine has to be locked in a closet, behind a key. And,
my $200 printer scanner fax will email me the incoming faxes.
Yeah, and if there's any way to go to this e-fax capacity to some degree, that would be a lot better, because there's times when a nurse or the health director is not physically in the office, but they'll get it, a notification, especially when it's a communicable disease that needs immediate follow-up. So having that as opposed to a fax that randomly comes into an office, and if no one's there to receive it, we might not get it until the next morning. So e-fax capacity is definitely a better option if we can do that.
I'm with you. It's just a question of how we do it. You can do it through an outside service. You can do it through a box you have, and it's a cost thing.
Yeah, definitely. If we can get it going, then we'll definitely take that route instead. I would rather go that route instead of a physical machine in there.
All right. So this is another action item. Investigates electronic fax options. Um, Jason, perhaps maybe you and I could work on this.
Yeah, that's fine.
Okay. All right. Any other action items that we haven't captured? We'll move on. All right. Well, thank you, Heather, and thank you, Mary Lou, for your time. And we look.
I want to thank you guys.
Yes,
So
thank
much.
you.
This has been a burning issue for us, and it's just so wonderful having people concerned and want to make it better. So thank you, all of you.
Well, thank you for all you do. So walking through these services it's incredible what services you provide to the town, and we greatly appreciate it. So, okay.
Thank you,
Have
Matt.
a good night, both.
Thank you, Tim.
Okay. All right.
Thanks.
Okay. We will move on to next portion of our agenda. We have 26 minutes left. So most important thing is we need to form an official opinion on town articles that are coming before town meeting this Saturday that have related tech spend. So this pulled up the warrant for town meeting, and the first one is the technology spend. And I think we've seen previous versions of this or some versions of this. I was wondering if, Jason, do you happen to have the detailed copy of the current version?
Of this here,
Yeah.
I don't have it on me right now, no.
Okay. Do you know if it's changed since we previously worked on it?
I don't believe that the numbers have changed from what I understand. The numbers have been exactly the same that was approved upon prior,
Okay.
in prior meetings.
Okay.
And this includes the revised line item for the servers, Matt, that we worked on a couple months ago.
Yeah, it does.
It's either this one or there was some other space. I don't know if I can't
Well, there's the
remember where it was.
capital item as well. Right.
Yeah. I think that was mostly under the capital item. I don't know if it's in this budget somewhere else.
No, it's a separate article for the capital budget. In fact, there are two capital articles.
Okay, so this was, I think, Article 7 and then Article 10. Is that right? Article 10.
Articles 10 and 11 are the capital articles.
Okay.
And they're split up depending on whether there's bonding involved, where they were supposed to be. They didn't quite get it right.
Okay, here we go. Information server, technology and storage, 40K. It's a capital item. Okay, let's, if it's okay with everybody, is there any discussion on these items? I think we've already previously reviewed them and so forth. I would like to take a official vote of our support, unless there's people who want to dissent.
It's not a dissension, but I mean, I think when we do next year's budget, we need to take a hard look at all the discussions that we've had with the departments and make sure that there's some funding allocated, whether that's within the individual department budget or within the centralized technology budget, to make sure that we can make some progress on what's going to come out of the survey, the strategy, as well as the requirements gathering for the departments.
Yeah.
I know we can't get that into this year's, but I think it would be something that we need to put it on our agenda to kind of make sure we're planning for it and that it's input that we can get into Jason's budget going forward.
Yeah, all of this, I feel all of our investigations and discussions with the different departments, as well as the town survey, it's going to give us basically all of the rich information we need to justify, hey, we need more technology in all of these departments and it needs to be funded. So
I think the only other comment I'll make about this is there's been a lot of discussion about how the money was intended to be spent. along the ways of justifying it. And at some point, we've got to close the loop and make sure that, just because the top line number gets passed by town meeting, that as time goes on through the year, it doesn't get spent in other ways. Because I mean, a lot of us stuck our necks out, to get particular things done. And it's not always the case that the follow through happens exactly that way. Not that people are evil. I mean, people may think there's some higher priority, but if the plans don't find their way here, then, we're going to diverge.
Yeah.
And that would be bad.
This is a partnership, this is a partnership with Jason, and we're going to work on, and, the MTC is not here to obviously micromanage each and every dollar or cent that's spent, but it is a partnership for the major line items that we've discussed, that we've put our necks out and promoting. If there's divergence, I'm sure Jason will bring them forward and we'll discuss them. So
it's not just Jason, it's all the technology managers in town by the bylaw. Jason just happens to be one who's very visible on these calls.
Extremely visible.
Yeah. Yeah, good point. All right. Yes, especially there's open discussion. We're going to hopefully get the position filled from the ex officio from the school board, because that's something we've been blind to, and it's quite concerning. So
I've seen to it that should be taken care of in the next few days.
Yep, that's great. Okay, any further topics? Any further discussion before we vote on these articles? So I think it's Article 7, which is the full budget here. And then that's the municipal technology, includes our committee budget. So we're going to get another $1,000, which is good. The technology budget itself. And then the server budget, which is Article 10. And then, Mr. Litt, did you say there was an Article 11 as well?
Article 11 is the other capital item. I don't remember if we have technology in that.
Yeah.
It doesn't look that way.
Yeah, I'm seeing it. So I think it's just 7 and 10. Okay. Any motion to support Articles 7 and 10 as is?
Move to support.
Okay, I'll take that verbal from Angela. Thank you. I second that. Verbal, go around the board, the committee, to support Articles 7 and 10, MTC support for Articles 7 and 10 as written as we go before town meeting. Will?
Aye.
Gary? I think that was an aye. You're muted. Do you want to unmute just to confirm?
Sorry. Yes. Aye.
Okay. Thank you. Angela?
Aye.
And likewise, myself, aye. Thank you. All right. No, we're running out of time, so let's prioritize. Let's do a brief discussion of the surveys. I propose to do a brief discussion of the surveys, the status, and the strategic tech plan. Maybe I'll go first with the surveys and just recap where we are on that, and then turn over to Angela to share with the tech plan and all the great work she's done with the flyer, trifold flyer for town meeting. So surveys are going well. They've been released. I hope everybody here and that's listening on YouTube, if anybody, it has gone through the survey. It is bettersboro.org. That's BETTERSBORO.org. And spend the time. It takes 20 to 30 minutes to go through this full survey. We know because we started collecting statistics on it. And on average, for better or for worse, people have been only going through half the survey questions, because it is a long one, and they've been spending about 15 minutes. So we can think about that for a redesign in the future. We received feedback that it was a long one, but this is one of those things we want to allow people to, fill out questions that are more of interest to them, etc.
How many
So
responses so far, Matt?
so far, I believe we have about, let me log in right this instant and find out. Last time I checked, it was 352 responses.
That's very
So
good.
That's very good. Yeah.
we've communicated through a number of channels, Facebook pages. I put out a couple of flyers at local businesses. 353 now. So I think there's still more opportunity to get more out there. I passed out flyers at my son's little league, my softball game, and Department of Public Works. I don't know if they're still doing it, but last weekend they ran their the road sign, which is kind of interesting. So by the way, I registered the bettersborough.org and .com, just and pointing both domains just to SurveyMonkey directly. I know we don't want sprawl of domain names, but just having something to, simple that people type in and go directly to the particular survey. And I called up the Department of Public Works and asked to put it on the road sign. And I asked about the character limit, and they said there's a limit of 9 characters on roadsides, and we want to be simple. And bettersborough.org doesn't fit in the 9 characters width. So I quickly, within a few minutes, registered Sboro, SBORO.org as well, and pointed it to it. And by the next morning, they had stood up, and it's now working. So if you go to the transfer station, you'll see, help improve Southborough. Go to sboro.org, and you'll get directly to the SurveyMonkey survey. We're also advertising it, of course, on this at town meeting on the flyer that Angela's going to share with us, and hoping to get more responses. We have a volunteer to help us analyze the results, data scientist actually in town, who volunteered at town meeting 2019 to help us with survey responses. And she contacted me and volunteered, and I pulled up her old email saying, hey, we finally did it. And she works as a data scientist for CVS Health. And it's going to be good. We're going to be using that, the contract that we agreed to as a committee that Mr. Litt worked up with town attorney on with her. And so probably beginning of June is when we'll start actually analyzing the data.
Matt, can I ask a quick question if you don't mind?
Sure. Yeah.
I should not be taking the survey, but I was just curious on what the questions were in the survey. If it's possible, I can see that survey.
Absolutely. Yeah. I'll happily share with you the survey tool or survey instrument, as they say. I'll send you a copy.
All right. Thank you. I was just curious on what the questions were.
Yeah, and if you have, obviously, you as a town employee, even though you're not in the town, you can would love to get your feedback on any of the technology related ones. So this was a collaboration between various town departments, feeding questions and revisions, as well as board of selectmen, advisory gave us comments, Department of Public Works, police, fire, youth and family services. I took it originally. This is actually a survey tool from, I think it was Kansas City, copied and pasted their survey, and then we tuned it for just Southborough, and a lot of broad support across different departments to collect. Library gave their input, etc. And the goal is hopefully turn this into an annual thing and turn it into a data-driven decision making. So yeah, it'd be great to figure out how we can improve for next time, and start learning from this.
Okay.
Any other questions on the status of the survey? Well, once again, our intention is to go to the end of the month, close it off, and then start analyzing the results in June.
That was my question. So you're going to run it till the end of May?
Yes. Okay. Let's go ahead and jump over to the strategic tech plan. Angela, you want to talk about that, and as well as your work on the flyer?
So we have our brochure. Thank you to everybody who provided feedback on it. I believe that I got most of the feedback in before we had to take it to the printer. But essentially it's a trifold, as you can see. We've got front and back. They have been delivered to the town clerk's office, and they're going to have them on the tables. So as people sign in to town meeting, they'll be able to take a copy. Inside, it just has all of kind of the big things about the 5-year strategy. So we talk about our goals and objectives. We talk about the desire to move towards a data-driven approach. We talk about our strategic themes. And then we do have the QR code where people can access the survey. So we point them to the QR code. And on the back, we talk a little bit about the MTC. We talk about some of the accomplishments. And we have, again, another QR code for the town MTC website so that people can get there. We did want to post a copy of the strategy, the full strategy, on the MTC website. And I don't know, Matt, where we landed with that in getting that up there. I know it has been posted because we've talked about it in committee in the past. But we want to make it kind of easily accessible for folks so that if they go out there, they can quickly see it and have access to it. And then we'll also, I believe, get the opportunity right before town meeting starts to just address the public via the microphone, point them towards the flyer, and just make sure that everybody knows that it's there and that we encourage them to take the survey.
Yeah, right now, the MTC website has the 22 March 2019 technology plan. It has a draft survey from 2019, January 6th, and pretty much nothing else. So it does need to be updated.
So this is a question about Civic Plus. Is it possible to delegate rights within Civic Plus to the MTC members to administer MTC portion of the town website?
It is, because it's been done before.
Yeah, I would. I mean, that's the part I don't know, so that's what I'm trying to figure out. And if it is, then by all means, I have no problem with that either. I just got to figure out where that lies. And I apologize if I don't have all the information you want on Civic Plus, but there's been so many other things that have come at me in the last 4 weeks.
Yeah, low priority.
The moment I get there, I will definitely get that information to you.
You walked into a firestorm, and we appreciate it. The reason I know this is that Will, I know, had direct access to the cable committee's stuff when he was working that.
Yeah.
Yes, I did. And I might still have, but yes, I did.
Is it possible, Jason, to have you post it on the website? I mean, long term, if somebody else has access, that's great. But given that the meeting is like Saturday and today's Thursday night, would we just be able to email that to you? Okay.
Yeah, and I have the access, so I can get up there. If it's like a document, then I have someone then internally that can help me out with posting that item up there. So if you have the documents, send them to me, and then I have a way of getting them up there. And like I said, I'm just trying to learn as far as how to, modify documents and put them up there specifically. So yeah, but
I'll resend it to you right after tonight's meeting, just so you have the absolute latest copy, and I'll send you the URL that we're trying to get it onto. And that way, if anybody does happen to access that QR code on the trifold, they'll at least be able to see it.
Has it changed since the one that you sent out by email a couple of days ago? Okay, because I want
the brochure or the strategy?
Yeah, the brochure.
The brochure, the final version was version 6. I did send that out, I believe, as the final working copy, but I can send you another copy, Larry, if that would be helpful.
Please do, so that I can make sure I include the most recent with the minutes.
I will.
Yeah, when you post PDFs to the website, it's important that they're searchable PDFs for accessibility reasons.
How do I make sure that my PDF is searchable? Do I have to do anything specific?
I would guess
depends how you generate it.
Yeah, if you send it to me, I can get it searchable.
Okay.
Okay, so Angela, if you send it to Larry for records, and then Larry, you'll generate a PDF that's searchable and supply it to Jason.
Send it back to Angela and Jason.
Okay, that's good.
It'll
I
go
assume
back and forth.
I assume that as long as within Word you do a save as PDF, then it should be searchable. But if you do a print, you never know whether
Yeah,
it's going to be searchable, right?
that's generally
That might
correct.
it might be a raster format if you do print, right? Yeah.
Okay.
All right. Okay. Thank you, Angela, for all of your work on that and putting that together. Um, it's exciting. All right. Let's see here. Any final things to cover for tonight's meeting? Um, just as FYI, to inform the committee, I've continued work, started work, picking up back where we left off with when Tom left, starting to work with Jason on doing security review at very beginning, putting together a data classification, data sensitivity level classification, as well as starting to do inventory of systems and starting off with a NIST CSF, which is Cybersecurity Framework. NIST CSF is a subset of 853, but it's a very pragmatic. It's a great starting point. So once we do that, if we ever wanted to expand and do the full 853, we could do so without losing anything. So, and of course, the framework simply starts off with you need to have an inventory of all your physical and virtual assets and so forth. So we'll be walking through that.
Yeah.
I can't remember if Tom did it before Matt, but maybe if it doesn't put Jason on the spot too much, I mean, should we have as a future part of our meetings, like a slot where if there is any urgent town technology business, you know, we've got a section on the agenda that's reserved for Jason to kind of tell us like, hey, you know, this happened over the last month, or, you know, I'm dealing with this issue. And, you know, that's a,
we do have a spot
we
on
do.
our agenda,
Okay.
yeah, specifically for like town technology, school administration, technology, public safety technology, et cetera. We sort of skipped over it. Apart from the budget review, we sort of skipped over it tonight. But we do have a couple minutes left. I don't know if there's anything, Jason, you want to bring before us.
Uh, I mean, the thing that I've actually emailed all of you already, which I'm pretty excited about, is getting the scans by the National Guard. That process is actually moving right along. I was showing Matt today some of the documentation they're looking for, which, you know, I wish we kind of would have, you know, I wish this document that me and Matt are going to be working on would have been in place to provide to the National Guard. So I'm going to be doing a lot of digging around to give them the information. I have a meeting with them coming up on Monday to talk about the process and to talk about the scope of the work. So, you know, this is really, you know, it gives us, all of us in the NTC and the town, a kind of a view of where our weak spots are, where we should strengthen our, you know, our security defenses. And like, you know, Matt had mentioned earlier today, you know, we can get at least this understanding, and then in a year from now, reanalyze the entire network, see where we are again, see if we fixed any of these holes that we had, you know, that we may or may not have in our system. And what, you know, the best part about this whole thing is that it's free. So they would definitely, you know, more than willing to come out and reach out to us, and they're going to come on site and they're going to kind of review everything. So yeah, that's probably one thing I wanted to kind of mention, because especially with the cybersecurity part, I know that, you know, all the meetings that I've, you know, watched or attended, cybersecurity seems like it's a very, very important thing for all of you. I mean, it's pretty obvious what's going on right now in the world, especially in the United States with gas lines going down and stuff like that, that this is very important to our town. So that's one step in the right direction. Next week, I'm going to start that process. I will keep you guys, you know, up to date on what's going on and what we find and what those findings are. And I would assume that would be something we would take offline so that we don't have to really share all of that information out there as well.
No, what you do is you schedule an executive session for that.
Okay. Yeah.
And
yeah,
you know, you can restrict that to the MTC and any guests you choose to invite who you think may have something to contribute.
Okay. Okay, definitely.
Can I add a couple of things that I think have some time issue to them?
Sure.
So there are two things that are going on here that I think we've got to start thinking about. One is that the governor's state of emergency is going to be lifted on June 15th. And there's going to be demand for hybrid in-person Zoom meetings. I think you got to start thinking about, how does that work? It was tried once with the selectmen sort of early on, and it was a dismal failure. But I think it's important, to be proactive about that, because people are going to start coming to you, Jason, about it. You shouldn't be
Yeah, and I've actually
surprised.
been looking into that as well. I actually went to the town of Medfield. I think it was Medfield. Sorry, one of the Meds that was out there recently with Vanessa, and we were talking about the whole hybrid process and what they had set up over there at the town. So I actually had started buying some equipment as well, but then like the rules started changing again as far as like, we can all be on site and be in person, and they're also working with Sam as well to try to get them on site. They're still talking to their committee to figure out whether or not they can come on site. So the whole purpose behind the hybrid would have been Sam could still record, the videos while on site, but also we would put our equipment incorporated with their equipment to kind of put the Zoom part of it in place. But because the rules have been changing so much, and now they're saying that we can pretty much just be out there as long as you're vaccinated, just be out there. It's been kind of tough to figure out whether or not Sam's going to do the hybrid part, or if we're just going to be on site and have people back inside the building again. A lot of that has to do with something that I can't control. But to your point, I've definitely been looking into it, and I've actually purchased some parts to make that piece happen if we get to that point.
Great. I mean, the legislature is still trying to work out what's allowed, but I know the demand is going to be for Zoom in addition to Sam, because there are people like me who don't even have cable. And cable is one way, and Zoom allows you to bring people in. So that was one thing I wanted to make sure was being thought about. The other thing that's come up recently is ARPA, not to be confused with the DoD thing that brought us the internet, but the American Recovery Protection Act, I think they're calling it, has two areas of focus that we ought to think about if there's a creative way to exploit. One of them is funds for broadband. And while we're fortunate in that, we have 2.5 cable providers in town who also provide internet, we also have our private fiber network. And so I'm wondering if there's a way that we can categorize adding some resiliency to that, maybe adding additional ISP connections to that, making sure that, we've captured all the town buildings, because I don't think we have yet, onto that network. I mean, that seems like it might be an opportunity to fund something that we'd like to do, but haven't had the budget for until now. I don't know what the deadline's going to be for application, but I want to put that on the radar in terms of, if we had infinite money, what would we do there? And then let's try and go after the money.
Hey, Tim, I'm sorry, go ahead, Jason.
No, I was actually going to kind of switch the topic for a second, only because I heard about applying for stuff. Because I remember there was a big conversation about switching us to a .gov. And I actually got some information from Jim internally that there's a way that we can pretty much switch us over to a .gov free of charge. They actually have this whole application process that I have already downloaded a lot of the process. And I was going to kind of work with you guys to kind of, because they want me to like write this whole reason to why we should be a .gov and everything like that. And I know all of you have a lot more understanding, with what that is and how I should write it up. So I definitely want to reach out to you guys about that. Just kind of piggybacking on that one.
Yeah, shoot them over to me. I'd be happy to help with that one.
Okay.
Tom had reported actually that there were some forums and other things that he wanted to get into that he couldn't without a .gov email address. So that's on top of the fact that I've been pushing for .gov for 6 or 7 years now.
Well, that's something I'd like to get us going into it.
The other thing I wanted to put out along the lines of the ARPA money is a second focus on ARPA money is water and sewer. You say technology, water and sewer. Well, I say SCADA, which is the supervisory control network and data analysis network that we have. I'm concerned about, cybersecurity on that. I don't know if it's as complete or, as up to date as people would like it to be. No one's dug into it. But again, here's funding that's targeted at that kind of infrastructure. So we need to get that up on the agenda. Again, if we had a blank check, what would we do? Then go after the money to do as much of it as we can. So I think those sort of 3 items have a bit of time urgency to them for the reasons given.
What was the third one? I just heard 2: funds for broadband and water and sewer.
Water and sewer, and the other was the hybrid Zoom meeting.
Oh, okay.
Tim,
hybrid Zoom
just one quick question. Maybe this might be a source of money, I don't know, but has the new FCC reversed some of the Ajit Pai things about fair market value in cable licenses?
Not that I've heard yet.
Okay.
There is some discussion about trying to at least get net neutrality back in play,
Right.
but that's still pending as far as I know.
Okay.
Okay. Thank you for those items. Do we have any volunteers to or thoughts on those items, or volunteers to run with them?
The 3 that were just thrown out?
Yeah, like I said, I was already starting a process with the hybrid stuff. So once I know more with
Okay.
Sam, then I can get involved with
Okay.
that as well.
So you'd be looking into that. How about
Jason, aren't you looking into the .gov thing as well?
Yeah, that's I already have an
Yeah,
email.
that-
All I got to do is start. I'm going to send that information to you guys,
Yeah.
so you can help me out as far as filling out that application.
forms? Yeah, we can help
Yeah.
fill out forms.
Okay.
And how about the SCADA water sewer something?
Fiber network.
Fiber network.
I'll take a look at that, since I'm also going to be looking into everybody's septic tank.
Well, Larry, isn't that more your expertise?
It might be, actually, Larry.
Yeah, the broadband part might be, yeah.
And
Water and
SCADA is
sewer.
basically another kind of network.
Yeah, water and sewer, I don't know a whole lot about, other than any other homeowner in South Row at this point.
But I think it's more just the control aspects of it.
Yeah,
right?
it's a network that operates valves and measures water going back and forth and that sort of thing.
Data thing, yeah.
If you want, I'd be happy to go along with you when you talk with Karen Galligan about it, who'd be the right contact. I mean, I have a background in that kind of stuff, but being just a random member of the public, I can't do it myself.
Mr. Stivers has a comment. I don't know how long you've had that, but I notice your hands raised.
A quick one, if I may, following up on Tim's comment about the American Rescue Plan Act. I think that's a lot more real than many people realize here. We're scheduled to get $500,000 by June 10th for that. That is fairly flexible in terms of what we can do with it around the COVID response, the broadband, the water and sewer, et cetera. And then we're going to get the other half of that within another year. And as best I can tell, we're lined up to get another $1 million that goes to Worcester County, but because it doesn't have a functioning government, that gets spread around to the towns in Worcester County. And not clear what the timing on that is, but I think the selectmen, town administrator are working to line up projects to take advantage of these funds. And again, anything you folks can offer to get on the table there. And I think that frankly, there are many ways in technology we can get set up to spend some of that money a lot faster than, for example, if we're trying to build a new road or bridge or something like that, or a new wastewater system or whatever. So not that there's guarantee about it, but this money is far more flexible than the CARES Act money. And I think there's going to be an interesting challenge to figure out good things to do with it. So anything you can suggest, I think it'd be great to get on the table. And who knows, it's almost sort of like the Wild West in a lot of ways, it sounds like to me, which is crazy. But let's try to make good use of the opportunity if we can. I think.
Yeah, Sam, I'm afraid that it's a use or lose thing too.
Yeah.
I mean, if we don't put our sticky hands out for it, it will go somewhere else or get turned back. And neither of those are good things.
I have great confidence that we can have very sticky hands. So go for it.
Okay.
I'll take that one, Matt. I'll put together a list
Oh.
of projects and estimates that we can submit to the Board of Selectmen for review.
Awesome.
Okay,
Thank
thanks.
you. Okay, I know we're way over. Let's find a time for a June meeting. And which may, depending on the governor's, the result may be in person. So, what does everybody's schedule look like for the week of the 14th?
14th.
So it would be the 15th. Would it be the
Say,
Tuesday night?
I'd say 15th. Yeah, does the 15th work for everybody?
Yeah, I can make any night that week except Monday, so the 15th is fine for me.
15th should be fine for me as
Well,
well.
Tuesdays are usually selectmen.
They are.
So
I
that-
think it's okay with if we, unless there's something that we need to present to the selectmen. I think it's okay if we co-schedule at the same time with them.
Well, from my point of view, they need adult supervision too, but
Wait a minute. I like to join your meetings, guys. I think you've been excluding me by having Tuesday night meetings.
The 15th would be fine with me as well, if that's going to be the date.
Would the 16th be better for people, or what is people's availability on the 16th?
I actually show an MTC placeholder.
Yeah, I
on the
was
16th.
going to say I already got one, so I guess we can't meet on that day.
15th works for me if it all works for everybody else.
16th works for me as well.
So,
Fine for me too.
Yeah, 16th works for me also.
okay.
As long as
16th
Sam's not allowed in.
Well, if Tim is here, then he's got adult supervision, so I
No,
can.
okay.
I'm very hard to discourage. I've been insulted by experts. So.
I'll take that as a challenge.
And
What
Jay,
date are
you're
we
o-
landing on, May?
Jay, are
Matt,
you
or
okay
we-
with it? Jay, are you okay with the 16th?
The 16th, yeah, the 16th is fine.
Okay. Let's do the 16th from 7 to, that's the Wednesday, June 16th from 7 to 9 p.m. And it looks like remote meeting one is open, not knowing whether it'll actually be used, but I'll block it off anyway, just to
Yeah.
go from there. Okay. Thank you,
Just
everyone.
one quick question. If we do meet on the 16th, 7 to 9, and it's going to be in person, is there going to be a traffic jam for rooms or something?
I will.
That part, yeah. We'll have to figure that part out, I guess.
Yeah, I'll figure it out. I'll find a room. Yeah, we'll
Right.
have to
Yeah.
find
I mean,
one.
do we have an old, I guess a year old now system of reserving rooms and things online, or did we ever not get that?
I don't know if it was ever fully rolled out, the online
Okay.
room reservation.
Right, okay.
Yeah.
We were working on that at some point.
Yeah, right.
I think that caused the pandemic, actually.
Yeah. Okay. Thank you, everyone. Let's go ahead and any motion to finish the meeting.
A move to adjourn.
May I
Second.
second that? All right, that's Angela seconded. Roll call vote to adjourn. Will,
Aye.
Larry,
Aye.
Angela,
Aye.
and myself, I as well. Thank you, everyone, for your time. Have
Yeah.
a great
Yeah.
rest of your evening. And
Larry,
Good night.
buried in the email I sent was a request for the latest version of the rules of procedure, please.
From me?
Yeah.
Okay.
Hey, Tim. It's Eileen.
Greetings.
I just
Hopefully I'll see you at town meeting.
Yeah, you will, because we're home because we had to come home early.
Oh dear.
okay, hopefully we'll see everybody in town meeting. It's good.
Okay.
All right.
Thank you.
See ya.
Good
All right,
night.
Okay, bye-bye.
bye.